Hello.
Hi, doctor.
How are you?
I'm good. How are you?
Good. Dr. Doe, and then you're meeting Dr. Rolfes soon. So let's try to set up this camera.
Yeah. From my end, it seems a bit fuzzy.
Fuzzy?
Mm-hmm.
So,
Okay, so should I move closer?
When I'm speaking, just want to see when I'm speaking, do you see me a bit fuzzy or is it pretty clear?
No, you're fuzzy.
Okay, so I think that's probably just maybe the camera, but when it gets saved on the live feed, it should be pretty clear, because when you're speaking and if you see yourself clearly, it should be okay.
Yeah, I'm clear on my end, actually.
Okay, then that's fine. It must be the Google Hangout, the way it's showing, probably.
too short for you.
Yeah, that's why I have books.
We have layers.
Yeah.
So if he, okay, so you sit.
Hello.
This is Dr. Rolfes.
Hi, Dr. Rolfes. How are you?
Good. How are you?
So
I'm
So-
good. How are you?
Yeah.
That's me
Yeah,
down there.
so you're right
so-
there.
Yeah, I think that's a good height.
Maybe a little bit lower to show more of your code and less of the picture.
Yeah, maybe.
Take one look out.
Did you check Lisa's patient before coming in here?
I did. Dr. Cox. Yeah, he said. Yeah, I think that is better. That shows a little bit more. Now, should that be closer? Or?
That looks good.
Because last time you said it was
So last
too
time I
close.
thought Dr. Doe was too close because it was just her face, and then you're watching it on your whole monitor. It was
Should I be sitting back like this? Well,
kind of. I think so.
okay, good.
Yeah.
Do
It's like
that.
we're in your living room. We're just having a little conversation.
Okay. How's
Can you
that?
hear
How
me
do
clearly?
I can hear you clearly.
Yes, I can. Yes. Just wanted to make sure you can hear me clearly. It doesn't matter if you can't hear me clearly, as long as the answers to the question is clear enough. We can do the rest from here and edit it, so it's fine.
Okay, so they'll be editing. So if I make a mistake, they'll patch it together or whatever.
Yes, we will definitely do that. Yes.
Okay, good. And if I have a problem with one of them, can I just say, okay, let me start over, and you ask me again?
Yes, definitely we'll do that. If you want to change or halfway through you think, no, I want to redo that, well, we can do that. Not an issue at all.
I think we'll be fine.
Okay, all right. So this is where you'll be sitting then, Dr. Rolfes. And please correct me. Am I pronouncing your name correct? Just so if.
Yeah. So it's 2 syllables, Rolfes.
Rolfes, okay. I just don't want to
Yes.
pronounce it wrong, so my apologies. So.
And one thing, when you ask me like some of the questions, or maybe in the beginning, so besides my license, my dental license, I have a dental anesthesia license. And since we're going to be talking about sedation, I don't know if you want to bring that up. I can bring it up too, but that change one of the questions around a little bit and say, you know, how is your practice, you know, special or unique? Or I understand that you have an anesthesia license as well. So, because we'll be talking about different forms of sedation, and one of them will be IV anesthesia.
Okay, okay. Okay. Well, I did a little introduction to the interview, so I can go over that with you, and it's just introducing the practice and yourself and the credentials and memberships, and then I do the introduction to you to DCA TV, and then we'll start the questions. But if you want me to change or add something in regards to what you just mentioned, I can do that after. Like, I can always re-record my introduction to the way that you want it. So how about this? We'll do the questions and the normal. I'll ask the questions. You'll do the answers. You doctor the introduction and change it as you please, and I'll just re-record it at my end and add it to the final video edit.
Great.
Yeah, so in case, I missed something, because I pretty much did my research and went on the web and got the details. So in case things have changed, or if you want me to add things, so I'll just send that to you via email. Change it as you please, and then I'll do that from my end and record it, and we'll put everything together.
Okay.
Yeah. So are you ready? We can start.
I am. I'm going to read my cheat sheet here one more time.
Okay, sure, no problem.
Yeah, now I'm ready.
Okay, so I'm just doing a one line for now, just for the edits. I'm just going to welcome you to DCA TV, and then you can say thank you for being here, whichever you like. Okay?
Okay.
All right. Welcome, Dr. Rolfes, to DCA TV, and thank you for being on the show today.
Thanks for having me.
Okay, great. So I'll just start with the questions then, Dr. Rolfes. Dr. Rolfes, can you tell us what is sedation dentistry?
I can, and I should probably preface that by saying that fear of the dental experience is really the most significant barrier to quality dental care. So with sedation dentistry, we have the ability to put people in an altered and more comfortable state to accomplish their dentistry with the pursuit of a quality outcome.
All right, I'm just muting myself as you speak, so I don't get any noises from my end. So,
okay, and it's
Rolfes.
Rolfes, almost like Rolfes.
Rolfes, is that right?
That's good, Rolfes. Yes.
Okay. So number 2 question: is sedation safe?
Sedation is very safe. As a matter of fact, statistically, and research shows us that sedated patients are actually treating them is much safer than a non-sedated patient. And the reason is we monitor heart rate and blood pressure, but when people are in a relaxed state, they do better, and their level of anxiety is lower, which downregulates certain hormones, and they're actually much safer than if they were not sedated.
Okay, perfect. 3rd question: what is the most common method of sedation?
So I should probably answer that by saying the most common method of sedation is inhalation anesthesia, or just the use of nitrous oxide. And use nitrous oxide because it's very safe, it's very easy to administer, and as soon as a patient stops breathing it, they're back to the normal state. They can drive a car, they can function normally. So that's the most common, but really there are 3 types. The second is with a little bit of oral sedation, a little pill, an anti-anxiety pill, and that's commonly used in dentistry. And that helps people. We usually combine that with a little nitrous oxide, but it just puts them in a mild altered state and makes them more comfortable so they can have their dentistry done. The 3rd technique is intravenous anesthesia. You have to have a special license for that. I've had that license for about 30 years now, but that's where we actually start an IV, and give the patient medications through an IV that make them relaxed and comfortable, and basically they fall asleep. And that's really the most effective way to sedate a patient. So I hope that answers that question.
Okay, perfect. Fourth question. What kinds of sedatives are used when sedation dentistry is performed on patients?
Well, we discussed that. We use the types of sedatives. The simple sedatives are like nitrous oxide, and then oral medication, much like Valium. And then we give the intravenous drugs, and that's usually a drug called Versed, and usually a narcotic like Demerol or fentanyl. And we have combinations of those medications. But the idea is to just make our patients relaxed and comfortable.
Okay. Will I feel pain?
Interestingly enough, the reason we sedate people is to deal with fear, anxiety, and pain. So all of these drugs that we give, especially in combination, are great for inhibiting and masking pain. We also use local anesthetic when we're doing procedures, but yes, a lot of these drugs that we give are pain management drugs. So for instance, when we go give a local anesthetic, most of our patients don't even remember us giving them an injection or a shot because their pain is managed, their anxiety is managed. So I hope that answers that.
Okay, thank you. And the last question, dentistry for everybody?
So it's not for everybody, but I would say it's for 95% of the population. So if a patient wants to be sedated and they think it's something that experience easier, more enjoyable, then I would say yes. The only person it might not be appropriate for is someone who's very medically compromised, if they have liver problems or kidney problems or breathing problems. And in that case, a lot of times we'll use a general anesthetic where they're intubated or we take them to a hospital. But the short answer is yes. It really, almost any patient can be sedated safely and effectively, and it can really help them, to get quality dental outcomes.
All right, that's perfect. So those are all the questions for the interview. As I said, that was pretty quick, and I think it went pretty well. And as I mentioned, I'll just forward you the details on the introduction for the video. Just have a quick glance at it, change it as you wish, and just send it back. We'll take a couple of weeks, probably, Doctor, just to edit everything together, make it look all smooth and nice. And we'll forward it to you for your approval before we do post it on our DCA TV website, and you can also use it for your webpage, your social media as well. So yeah.
Well, we look forward to that. So thank you. So I'll get Dr. Doe because I think she's doing one also, correct?
Dr. Doe, I'm not sure. I was not notified in regards to any of the questions that she was going to be doing. So I'm not sure, yeah. I
thought she was doing one on laser dentistry today or something like that.
Oh, okay, well, maybe I'll just speak to her because I wasn't informed of the questions. I mean, if I have the questions, I can just definitely ask her and get that done. So yeah, but thank you for your time. I'll also speak to her, yeah.
I'll go get her.
Okay, thank you.
Okay, so do you want to do mine too or no?
Well, for some reason I don't have the questions, Dr. Doe. I was not forwarded the questions. Yeah, so I'll have to check with my coordinator because I was getting the emails back and forth with her, and I only got the sedation dentistry one. So unless I really missed an email, which I'm pretty sure I didn't, because did they forward any questions to you at all?
Yeah, so the first one was pain-free and then laser dentistry. Or all, it was like 3 topics. So we said Dr. Rolfes too, and then I would do laser.
Yeah, so I apologize because I only got the sedation dentistry for Dr. Rolfes, and I didn't get the second part of the question, so it must be just a communication from our end. So I really don't even have the questions at my end. I'm just wondering, I don't want to waste your time as well. And you said you already have the questions, correct?
Yeah, I just looked at it a millisecond ago. So basically it was, yeah, so I just looked at it. I mean, I'm fine, but basically it was, did you guys do pain-free dentistry too? Or just sedation?
We just did sedation dentistry because I got the coordinator who was doing the emails back in Romaine, I believe. She only sent me the sedation dentistry, so I had the questions ready for that. I didn't get the other questions at all, and again, I do really apologize for that from my end. Is there another time that might work best for you, or if I have the questions, or I don't know if you have the questions handy by any chance, Dr. Doe?
Yeah, let's see. So the first one was, what is laser dentistry?
Mm-hmm.
And then the second one was, what are the advantages of laser dentistry?
Okay.
And then can everyone use, can adults and children use laser dentistry? And then there's something else I don't remember.
Yeah, I'm just going through my emails here as I'm speaking to you, and I honestly cannot locate it. So that's the reason I was just surprised. I only thought we did the sedation dentistry. So if you want, because I know you're busy and you have patients as well, I can do these 3 questions and then you can do the answer for it, and we'll put the video together, just like what I was doing for Dr. Rolfes, and we'll send it to you for your approval. Would that work for you?
Yeah, that's fine. So then you didn't even do his pain-free dentistry part then?
Yes, yeah, those pain-free is also not there. I'm not, as I said, I'm really confused on those 2 topics, why I didn't get those things
Okay.
forwarded to me by the coordinator.
Do you want me to be on there?
Yeah, I mean, I just need the questions only, actually, because both of you obviously know the answers, which you need to tell me. So if I just have the questions, that's more than enough for me to just finish the interview. Yeah.
Okay, let me go look.
Okay, thank you, Dr. Doe.
Okay. So the first question is, what is laser dentistry and how does it work?
Okay.
And then next question is, what are the advantages of laser treatment?
Okay.
And then how are lasers used to remove tooth decay?
Okay.
Can lasers be used effectively to whiten teeth?
Okay.
Is laser dentistry safe for all ages?
Okay, perfect. So you'll be covering that topic, correct, Dr. Doe? Okay. So as I mentioned to Dr. Rolfes, and I'm having a hard time pronouncing his name as well, so hopefully I'll do an introduction separately from this recording, just an introduction to you on the topic, and we'll put it all together, and then we'll forward it to you for approval.
Okay, that's fine. Yeah. So it's similar to what I did last time, right? With DCA?
Yes, yes, yeah. Similar to, I think you've done one before, right?
Yeah, I did 3 topics last time.
Yes, perfect. So I'm just gonna introduce you just to say welcome, and then you can say where you like, and we'll just run through the questions and do the answers.
Okay, sounds good.
Okay. Welcome, Dr. Doe, to DCA TV, and thank you for being on the show today.
Thank you.
Okay, perfect. So we'll run through the questions, Dr. Doe. What is laser dentistry and how does it work?
Laser dentistry is one of the newest, greatest inventions in dentistry. It's a way for patients to get dental treatment done with the potential of no anesthetic, definitely with better post-operative healing time, and for everyone to be able to get no, do we get knocked out or?
No, I'm here. I just turned off my microphone because I don't want any noises from my end to come to you.
Okay, so we have to do it again.
Yeah, so do you want me to ask you the question again? So what I'll do is I'll ask the question, I'll turn off my mic and cam so the streaming is clear, and then for the question again, I'll turn on the camera and ask you the question.
I see. Okay, that's fine. Okay.
Okay, so sure. What is laser dentistry and how does it work?
Laser dentistry is one of the newer dental technologies that make going to the dentist very, very easy and helpful for patients who are scared of the dentist. So the way the laser works is it uses laser as water molecules, and then water is actually what comes out of the laser to remove cavities, decay, and any soft tissue areas that are not very healthy.
Okay, perfect. Second question. What are the advantages of laser treatment?
Some of the advantages of laser treatment are, one, that you can actually get laser dentistry done without getting a shot. Another advantage of laser dentistry is the no drill. Another advantage is post-operative healing time is twice as fast as the traditional method. And a lot of times laser dentistry is helping to have high fear, high anxiety, don't have the same by getting dental laser treatment.
Okay. Third question. How are lasers used to remove pardon me, let me repeat that. How are lasers used to remove tooth decay?
The water lace or laser dentistry is used to remove tooth decay by using the laser energy from the laser and energizing the water molecules. So water is what ends up removing the tooth decay and making it very easy procedure, making it a very easy procedure for the patient.
Did we want to re-record that answer? Because I think halfway we kind of, would that be better? Just if you can repeat the answer for it, we can just use this.
Because it's kind of an odd question. It's like hard to explain to patients.
Yeah, so it was, how are lasers used to remove tooth decay?
Okay. Okay, let me think of an easier explanation. Okay, that's fine. Go ahead and ask me.
Okay, so I'll ask the question again. How are lasers used to remove tooth decay?
So lasers are used to remove tooth decay by using the water that comes out of the laser machine to remove the tooth decay. So it's actually water that is removing the cavity, the decay that the patient has inside their mouth.
Okay, I think that was better. Question 4. Can lasers be used effectively to whiten teeth?
Lasers can be effectively used to whiten teeth. One of the major advantages of using laser to whiten teeth is the lack of sensitivity or the decreasing of sensitivity that patients get when they have their teeth whitened with the laser. Ideally, you end up getting the same result as if you're using custom trays, but a lot of times the sensitivity is down if you're actually using laser for whitening.
Okay. And last question for laser dentistry here. Is laser dentistry safe for all ages?
Laser dentistry is definitely safe for all ages. Children love the laser because, number one, you never have to give anesthetic for removing tooth decay or doing any soft tissue procedures. For adults, it's also super safe to be using the laser for them, and it can do multiple different dental procedures for adults and children while being very conservative and sometimes eliminating the shot.
Okay, perfect. So we've completed all the questions for laser dentistry then. And Dr. Doe, will you be doing it for the pain-free dentistry as well?
Oh, I think Dr. Rolfes was supposed to, but
Okay, because I think there was only about 3 questions on that.
so it says, to have pain-free dentistry, can I really relax in the dentist chair?
Mm-hmm.
Should I allow my past experience with pain? Should I give up on pain-free dentistry? I don't know. These are kind of odd questions to me. Like,
Okay.
because if you say, to have a pain-free dentistry, can I really relax in the dentist chair? Well, of course, you know, like, but I'm not sure what reason would you say, unless you're trying to tell them, like, no, you know, you have to kind of figure out what their anxiety is driven by their anxiety, whether it's shot or just going through the door of a dental office. So I'm not sure I can answer that one, like,
Okay.
to the great. And then, should I allow my past experiences with pain to keep me from going to the dentist? So no, because otherwise you'll have more problems if you. And then, should I give up on pain-free dentistry if my local dentist? So, but here, what are they trying to say for pain-free dentistry? Is that laser dentistry because you have no shot, or is it having sedation for pain-free dentistry?
Yeah, I think that's probably what we have to figure out. So on those, so since the questions are vague, maybe we will leave the pain-free dentistry and have maybe get a bit more clear questions that won't kind of confuse patients or anybody who's listening to it for now. Because because
when I saw it, I told Dr. Rolfes to do it.
Oh, okay. Unless he feels comfortable answering those 3 questions, then definitely we can go ahead. So I'm not sure if he's with the patient again, yeah.
Because it doesn't. I don't know. It doesn't sound that like compelling.
Yes, yeah. So we might just take that part of it off and just do the 2 videos, the one that he did and the one that we did on laser, which we did. So that'll give us 2 videos to work with and edit and work with, and then we'll send it back to you to see how you like it and go from there.
Okay, that sounds great.
Yeah, and I'll also do a little introduction, which I also mentioned to Dr. Rolfes as well for the video. I'll do that recording, just write everything down and forward it to you. If you need any changes done before I actually do the interview, just let me know, and then I'll do the recording as you require on the intro.
Okay, that sounds good.
Yeah. So, yeah.
Okay, great.
Yeah. So thank you very much for your time, taking the time out of your busy schedule today. So I really appreciate it.
For your help.
All right.
Okay.
All right. Have a great day.
You too.
Bye.
Okay.